Monsoon season brings along a surge in respiratory symptoms like cough, nasal congestion or breathing difficulty. These symptoms occur due to exposure to cold air, increased humidity, dampened atmosphere and dispersal of pollens that aggravate the allergic response and create an ambient temperature for molds, viruses and bacteria to grow and cause serious respiratory illness in patients with allergic diseases like asthma, bronchitis and others. Key preventive measures this season should be hydration, hygiene, diet, warm saline gargles and steam inhalation, wearing masks, avoiding crowded places, avoiding outdoor activities, use of optimal inhalers, nasal sprays, vaccinations and medications as prescribed by the specialist. Hence, stay hydrated, prioritize hygiene for this monsoon.